Dereta, dereta, dereta. Stop, stop, stop. Okay, okay. Up, 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 up. Don't move. Asparagus.
Hey guys, what's up? This is Stephanie and welcome back to my channel. So in the video today, I'm going to be talking about OSCEs. OSCEs. So what are OSCEs? OSCEs are usually done during clinical year. It's a form of examination where your professors see how you are with your patients or patient skills. They see whether you're good at obtaining for example, a patient history, past medical history, social history, your review of systems, how are your physical examination skills, are you doing the appropriate physical examination skills for what the complaint is coming or what the complaint is, are you doing the special exams, right, like if the patient's coming in for a possible appendicitis, are you doing your Rothstein sign, the McBurney's point, etc. So that's what an OSCE is. It's usually done during your clinical year. Programs tend to differ on how they do them. For example, for my program, we would get an OSCE for every rotation. So if it was an OB-GYN rotation, we would do an OSCE for OB-GYN. It would be on any topic in regards to OB-GYN. So we did a lot of pelvic exams, OSCEs, and also some of my classmates also had like a breast exam OSCE. So it's depending on what rotation it's in. If it's pediatrics, you get a pediatrics. Psych is a whole different one, right? So that's what an OSCE is. And my program does it for every rotation. Now, I know some programs, like one of my classmates, she said that her program, she only gets one for the entire clinical rotation. So she'll get one final OSCE before she graduates. And so my program, we get one for each rotation, and then at the end, we get one final one. And it can be just super random. And sometimes it's very nerve-wracking for these. And that's the whole reason why I'm making this video, is because I have to say that my last OSCE, I did not do well whatsoever. It was not one of my lowest ones, because my lowest one OSCE was my first OSCE, which was my ER OSCE, and the reason is because I didn't know what to expect. I was very nervous, and I'm just a very shy and nervous individual in general. I suffer from generalized anxiety disorder. From those of you who cannot tell, that I speak really fast, and so I suffer from that, and also your panic attacks. And so during that OSCE, I did not do very well. I definitely missed a lot of things during the physical exam that I should have checked. My complaint was and diagnosis was a DVT, so it was like calf pain, and I did not do the Holman sign, even though, you know, that's controversial on how specific it is to diagnose a DVT. Regardless, I should have done it on the physical exam. I did not do that. I didn't even bother to check the calf or measure the calf and compare it to the other calf. I was just really nervous. That was probably my worst one. But I just finished my last OSCE, and I have to say that I was very disappointed in myself because I did not do as well as I thought I was going to do. Being that it was my last OSCE, I definitely started to have like the feeling that when you're about to get a panic attack. And I think one of the reasons is that I'm very claustrophobic, and I had to wear a lot of PPE, and it's something that I really need to get over with. And you guys can probably comment below and agree, is that I need to get over my PPE and just my claustrophobic fear, because I want to work in critical care medicine. I want to work in ICU. I find infectious diseases very, very interesting, and I wish to do that also. And being in that, you're going to be in PPE, and I can't be, you know, freaking out and having all these panic attacks. And I really am grateful for this providers, you know, the doctors that are wearing PPE, the nurses that are wearing PPE like all the time, 24 hours a day, when they're seeing patients. I commend you guys, because I could not do it for an OSCE that was like less than 20 minutes. Anyways, I have very bad claustrophobia. I had it don on the PPE because we wanted to make sure that we were protecting the patient, and of course, you know, all professors. So I went inside the room and saw the patient. I had the complaint of generalized weakness, which is a very, very tough complaint because there's so many differential diagnoses that you can have in regards to your generalized weakness. And so you have to make sure that you're asking the correct questions in the history, you're obtaining a good past medical history, and then having a good differential diagnosis in your mind and doing a good physical exam. And so what I did, and I messed up, is that I anchored. And this was one of the things that one of my preceptors taught me not to do is to anchor. And what does that mean? Is to anchor on a diagnosis, to be so, you know, this is what the diagnosis is and this is what it is, and it blinds you from all the other differential diagnosis, and that's what I ended up doing with this patient. And so she started telling me that she was constipated, she felt really dry, her skin was dry, etc. And it kind of painted me the picture of hypothyroidism. And so that's what I thought it was, hypothyroidism. So then I'm doing the physical exam, and being that I'm in this PPE and I started having this panic attack, I started hyperventilating, so I started breathing really, really quick. When I was doing the physical exam, since I was breathing so quickly, I was telling the patient to breathe quickly. So I was telling him, breathe in, breathe out, breathe in, the same way as I was. And my professor had to go and stop me and tell me, hey, like, you need to tell her to breathe slower or she's gonna pass out on you. And I was like, oh my goodness, yes, I do. And so I zoomed through the physical exam. Like, I was doing everything super fast because I was just really anxious. And that was, I think, one of my downfalls. And even my professor told me, like, hey, you need to, like, take a chill pill, like, relax, because you are, you know, stressing me out and you're stressing the patient out. And it was like a volunteer, thankfully. And so, yeah, I didn't end up doing as well. I missed a lot of things. I ended up diagnosing her with hypothyroidism. My differential diagnosis was not as good as it should have been because I was so nervous. I mean, there's so many other things you can diagnose a patient with. I didn't ask her if she was depressed, you know. She told me she had an enlarged lymph node. I didn't even bother to check because, you know, this could also be something like a possible cancer, like lymphoma. Sometimes they present with your B signs, right? Your fever, your sweating, and that's what she had. She had symptoms like sweating, and I stuck onto hypothyroidism. It could have been hyperthyroidism also. She could have been anemic. I didn't even bother to check the skin. I didn't even bother to feel the temperature of the skin. I didn't even bother to check the reflexes. I could have checked the knee reflexes to see this was hyper or hypothyroidism. I didn't even bother to check her hair, you know. She was complaining her hair was falling off. And so I missed a lot of things on this OSCE, and I didn't do well whatsoever. Definitely was not one of my lowest ones, but I would say one of my second lowest OSCEs. And the reason why I'm making this video is that we all make mistakes. So for those of you who have taken your OSCE and you didn't do as well as you thought you would, you know, just learn from that. And I know definitely when I was driving back, I was so upset with myself because this was my last OSCE, and I was like, I should have been on my A game. Like, I should have been like, you know what, I got this, and scored well because I finished all my clinical rotations, but I didn't. Unfortunately, my anxiety got the best of me, and so we're all humans, we make mistakes, and I definitely learned from that. And I just wanted to share this experience with you guys, just to let you guys know that you aren't the only one. I know some of my classmates have felt the same way, and then some of my other classmates I did extremely well. Unfortunately, once again, my anxiety got the worst of me, and so I'm really working on that, and I have been working on my physical exam skills because I feel like that's something that I am lacking on. And a physical exam can tell you so much on a patient. Also, just taking a good history can tell you so much on a patient, and I did not do that in this situation. So hopefully this experience is helpful for you guys. You're not the only one. You just learn from that, and you make sure that you want to get better. I do have to say that I think after my first ER OSCE, which was my first OSCE, I did a lot better on the rest of my OSCEs, like improved, like I think 10 points, not 20 points, a lot better. But you just learn from these mistakes. So hopefully this video is helpful for you guys. If you have any questions, as always, or any comments, concerns, comment below, or send me an Instagram message, and I will talk to you guys soon as I can, okay? Alright guys, I'll talk to you guys later. Bye.